Good day. Thank you for the invitation. And for the next couple of minutes, I'm going to present to you the different linkages between our health and the health of our planet, and why climate change is an important public health and medical issue. So as we speak, we know that climate change is continuing to happen. The United Nations already said we only have 10 years remaining to really avert the crisis, the global crisis. And it's really important that we in the medical sector pay attention to this existential crisis that will definitely affect the health of our patients and our entire communities. And as a medical student, way back at the UP College of Medicine, early on, I already acknowledged climate change as the biggest global health threat of the 21st century. You'll see a picture of myself there with a placard in front of UPCM. And in 2015, The Lancet, which, as we know, a medical journal, also announced that tackling climate change could be the greatest global health opportunity of the 21st century. And it's so important that we in the medical sector are not just aware of the various linkages between climate and health, but also the range of solutions that are within our reach so that we can avert this crisis and improve the people's health. And that is why my mindset has always been, that my patients are not just the people, not just our human patients, but also the planet in which we live, we thrive, which provides us health and well-being. And that's why, in the past few years, I've been deeply involved in the development of this new discipline called planetary health. Planetary health is a reaction to the more popular and more established field of public health, which pertains to the health of people, period. But this time, in this day and age of climate change and other ecological changes that affect human health, we need a more holistic view that brings together the health of people and the health of the planet. And that's how planetary health, this new discipline, was born. This illustration shows to you how climate change and human health are connected in many different ways. And I'll not belabor you with the details of these diagram, but as you can see on your left, the first message is that there's so many pathways that link climate change to human health, whether it's storms or typhoons, as we call them here in the Philippines, or droughts, or flooding, or heat waves, exposure to intense heat. So there are multiple pathways. And then on your right, you will see that basically no single disease group is immune to the effects of long-term climate change, whether it's cardiovascular disease or infectious diseases like a lot of the vector-borne diseases, malaria, dengue, even undernutrition. There's even a report by the Lancet that says there can be a 50 years worth of gains in nutrition that can be reversed if we do not get our acts together in trying to address climate change. And then, of course, mental health is now a growing area of climate and health research. And here are just some of the numbers from the WHO. And I just want to remind you, these are all conservative estimates. Estimates of specific diseases. Not all diseases have been covered by these mathematical projections. 250,000 deaths annually due to climate change alone, starting from 2030 onwards. And all these diseases, whether it's heat-related illness or diarrheal disease or malaria, malnutrition, all of these have strong links to climate change and environmental factors. And these will add to the existing global health burden already caused by a wide array of disease. So it will definitely strain our health systems worldwide. And the sad story is that the effects of climate change on human health are inequitably distributed. As you can see at the top map, the parts of the world that have been magnified are the countries that have emitted the greatest amount of greenhouse gases for the past century, and those are Europe, North America, and also China, which is a more recent major emitter. But at the bottom, you will see the parts of the world that will be bearing the brunt, the health consequences of climate change. And those are Africa, Asia, including the Philippines, even the Pacific Islands that are too small to be magnified in this map. If not, they've already been erased from the face of the earth because of sea level rise due to climate change. And you know, as you can see, there's no overlap in terms of the countries that are really the culprit of this global crisis, but also the countries that will be worse affected by the health effects of climate change. And as you can see in this map, the redder the country is, the more vulnerable the country is to climate change. And Southeast Asia is in general a climate and health hotspot. But as you can see there, the reddest of them all, of these countries, is our home country, the Philippines. And so we can anticipate that our country, will be experiencing a lot of these climate-related health impacts in the years and decades to come. And a while ago, I mentioned the term planetary health. It's no surprise that planetary health and pH, share the same letters, pH. And indeed, the Philippines is at the heart of the planetary health crisis. This is a picture I'm sure you're familiar with, taken from Typhoon Haiyan in 2013, which is the strongest typhoon to ever hit land in human history. Definitely, it has strong links with climate change. And, you know, typhoons have already become bigger in size and in magnitude and severity, and more frequent as well. Before, as we know, we've been frequented by 20 typhoons each year. Now we're seeing the number either becoming more erratic and unpredictable or increasing in number. And here you will see that when climate-related extreme weather events do occur, it's not just, you know, our houses and buildings, livelihood, agricultural systems, educational systems that are destroyed and disturbed, but also healthcare systems, and health workers already also become victims themselves. And ultimately, our communities, new diseases are generated, injuries resulting from the direct exposure to the elements, whether it's flooding or, you know, strong winds. And I remember the day after Typhoon Haiyan happened, in the front page of the Philippine Daily Inquirer, it has been described as the worst disaster to hit PH. And as we know, PH stands for the Philippines, the people's health, public health, and also planetary health. And in my doctoral thesis, I investigated what are these wide range of health impacts that are going to afflict the Filipino people, especially in coastal municipalities in rural Philippines, in terms of climate change and the health consequences. And it's not just really the extreme weather events, the typhoons and the flooding, but there are also, and I wanted to focus on at the bottom, there are anticipated health impacts that have already been documented in other places, but are also very likely to happen in countries like the Philippines. And for example, increasing number of heat-related deaths as, you know, ambient temperature, but also, the sudden spikes in ambient temperature in heat. If they occur, then we expect more heat-related illness, if not deaths, but also mental stress due to long-term, chronic stress resulting from the insecurity that climate change does bring to, whether it's food or exposure to heat in the workplace. If you're a farmer while in the farm, but also hypertension resulting from salt intake, and I have a separate slide on that in a short while. Here you will see that vector-borne diseases are highly climate sensitive. Dengue, for example, we know it's increasing in number each year, but also its distribution is continuously expanding. Last year in 2019, there's already a report of dengue already showing up in places like Europe, which is a temperate region of the world. And so tropical diseases moving to new areas is certainly highly correlated with climate change and ecological change. And then here you will see that the country, the Philippines, is actually facing the fastest rate of sea level rise. And we know sea level rise comes from the melting of the ice caps, for example, in the Arctic. And when sea level rise does occur, it leads to more flooding and more seawater intrusion into the drinking water, into the fresh water. And this is what's happening now in places like Bangladesh. There's growing evidence that there's a strong link between the increasing salinity of drinking water and health outcomes. And when you drink water that is high in salt, that leads, or that can lead, and that is already shown to lead to a wide variety of health effects, whether it's increasing hypertension rates. And this is interesting because we know hypertension, you get it from high salt intake from food, but this time you obtain it from water. And also, preeclampsia and gestational hypertension in mothers, even increasing kidney disease and kidney stones. So all of these diseases that result from increasing levels of salt in the blood have relationships or correlations with increasing sea level, especially in coastal communities in countries like Bangladesh, and we can anticipate this will be happening in the Philippines as well. There's another illustration of how increasing salinity of drinking water as a result of sea level rise does affect a wide range of health outcomes, not just hypertension, not just preeclampsia and gestational hypertension, but even the increasing incidence of cholera and diarrheal disease outbreaks. There are also links between vector-borne diseases, as mosquitoes eventually also become salinity tolerant, as you can see in this graph. And of course, ultimately, when sea level rise becomes really severe, people get displaced and people need to move out of their settlements along coastlines. And now we're seeing in countries in the Pacific, islands are disappearing. Island nations already exploring to purchase land in countries like Australia to be able to relocate and avoid this long-term consequence of sea level rise. And here, there's even a term that has been introduced, climate change refugee, which I actually disagree with, because refugees is a term used for people who flee away from, let's say, a persecutorial government, a conflict zone, a war zone. But these people are not trying to move away from political instability and dictatorial governments, for example. Instead, they are trying to escape from environmental phenomena that have strong links with human activity, because as we know, climate change is generated by our own emissions, our burning of fossil fuels for electricity use, or emissions from other sectors like agriculture. And so it's a different kind of battle and war that we're having. And the term refugee does not give justice to what I would even prefer to be called as climate migrants or climate or environmental migrants. And so the question for us in the health sector, are we ready to build health systems that consider the climate? And that is a picture of myself in Ahuy, Iloilo, where increasing sea level has already started to occur in smaller islands. And as we know, in the Philippines, we have this unfinished business of achieving universal healthcare, which unfortunately is now being threatened by COVID, as we hear news that PhilHealth is trying to delay the implementation of universal health care. Of course, we know that we need UHC in order to combat COVID-19, but also to prepare us for long-term climate change, because universal healthcare systems are strong health systems that can withstand climate impacts and can also make sure that there's healthcare access for those who will be affected inevitably by climate change and its health effects. But we also need to act on climate change, reduce our carbon emissions, and ensure the resilience of our people so that it does not add further burden to resource-limited universal healthcare systems. So as you can see, it takes two to tango. We need UHC and we need action on the climate in order to achieve health and health equity. And that is why I think that the health systems of the future for the 21st century in the era of planetary health should be first universal. That means accessible to everyone all the time, but also high value, healthcare system that is of high quality, less wastage and less inefficiency, resulting in good outcomes, less iatrogenic, outcomes, and improve patient safety. But also, and these are two things that we need to add, and I will be remiss to not include this characteristic that health systems should be pandemic resistant. We should be able to detect early and respond quickly when an outbreak does show up at our doorstep, and it leads us to a better recovery. And that's what we're trying to do now with COVID-19. But also we need health systems to be climate smart. And climate smart is a term that brings together our responsibility to reduce our own emissions. And that is why it says they're low carbon and green sustainable healthcare. But also we need healthcare to be resilient and disaster ready, responsive to the health consequences of climate change that I just mentioned a while ago. And so, there's so many frameworks that have been introduced. For example, this idea of a climate smart healthcare has already been embraced by institutions like the World Bank, linking sustainability, green healthcare, and resilience, how to make sure that our health systems bend but do not break when these climate-related shocks and stresses do occur. And so when it comes to being low carbon, there's a study that says the global healthcare sector emits around 4% of the global emissions, and national level of carbon footprinting assessments have already been done. It's 10% of the US economy, around 5% of Australia and the Chinese economy. But what is important to read in this slide is that there are many opportunities for the health sector to remove its own or to reduce its own emissions, particularly from electricity generation, and the food that we consume in the hospital, the way we purchase our pharmaceuticals, adoption of green purchasing practices, and a better treatment of our wastes, of our medical wastes in the hospitals and clinics. And that is why I invite you to visit, this framework by Healthcare Without Harm. It's an international NGO that I worked for before, and they have this framework called Global Green and Healthy Hospitals. 10 action items that hospitals can adopt in order to reduce their emission and to really help in the restoration of the earth, which brings us health and well-being. So the way we manage our chemicals, the types of food that we provide to our staff and our patients alike, the design of our hospital buildings, purchasing requirements, etc. But also, as I've said, health systems should be climate resilient. And as you can see here, we need health systems that recover and even transform when crises such as climate change or COVID does occur, and not health systems that collapse, as you can see in that in this diagram. And WHO came up with a framework for climate resilient health systems. I'll not go into detail, but as you can see, we need to ensure that climate change is mainstreamed in our vertical programs for different diseases, tuberculosis, HIV, nutrition, non-communicable diseases, but also in other aspects of the health system, financing, our information systems, are they integrated with climate data? Our health workforce, are they educated in medical and nursing schools with information about the links between climate and health? And then, of course, because I'm talking to clinicians, a lot of you, there are also a lot of clinical applications when it comes to this knowledge around climate and health. And I invited to this article by my colleagues at Harvard who actually did this very interactive feature of the New England Journal of Medicine, which shows to us how climate change is going to affect every organ system. So this is very interesting platform and very instructive. And let me just share some of the clinical correlates between climate change and health. And for example, one is in the area of diabetes. Maybe we're not, it's not in our radar that there are links between diabetes and climate change. And we know that diabetics have an impaired capacity to dissipate heat. And that actually will increase their vulnerability to heat-related related illnesses, for example, due to exposure to intense heat, like a heat wave. And, this is an emerging area of research. And as you can see there, at least now, there are at least two main mechanisms that really impair the ability of diabetics to dissipate heat. One is reduced vasodilation. The other one is through, impairment in the eccrine sweating. And below you will see some of the explanations. And this is an important area for not just for research, but also for clinical practice, because this means, we need to ensure that patients have really good glycemic control. And because, poor glycemic control will then exacerbate these mechanisms, which eventually will affect, body temperature regulation in diabetics and will lead to more heat-related illness in this particular population in the long run. So I invite you to look at these papers. And the other one is, for example, in the area of chronic kidney disease. So a while ago, it shows you how, an internal medicine condition like diabetes renders patients more vulnerable to climate change. But this time, it shows to us how climate change can actually generate new diseases or new forms or new types of diseases that we already know, such as heat stress nephropathy. And it's interesting because there are studies that are already showing that there are places where there's an epidemic of chronic kidney disease that are not associated with either diabetes or hypertension, but instead associated with recurrent heat exposure alongside, physical exertion and inadequate hydration. So when all these things happen at the same time, then that creates, this new type of kidney injury. And I'm not going to detail, as you can see, when exposure to extreme heat will lead to these different mechanisms, rhabdomyolysis and hyperthermia and external extracellular volume depletion, which then will activate all these mechanisms, vasopressin effects, renal ischemia, hypokalemia, which eventually will lead to repeated acute kidney injury. And if that gets sustained, you can have chronic interstitial fibrosis. And, this is another arena. And I'm sure, if we examine other organ systems, we might be able to see a lot of these interconnections between exposure to extreme heat and leading to a wide range of health conditions that we've probably never seen before. And then, of course, when it comes to climate, mental health, there's also a growing body of literature that links climate change and mental health. And we might be only thinking of, post-traumatic stress disorder as a result of, let's say, a natural calamity like Typhoon Haiyan. But we are also starting to look at the more subtle and more invisible and more chronic types of mental health conditions associated with long-term exposure to climate change, whether it's heat or food insecurity, etc. There's even a term that has already been proposed: ecological grief and eco-anxiety. And it's important that when we try to elucidate the mental health consequences of climate change, we adopt a systems thinking approach. As you can see in this diagram, there's no singular linear pathway that links climate change to mental health. It's definitely multifactorial, and we need to understand those difficult and convoluted interconnections. And then this is another important area for clinical practice. And this is a very new area, which is how climate change is going to affect our pharmaceuticals, our medicines, our drugs. And there are some papers that have already ventured this new area of inquiry. And as you can see, climate change will lead to more climate sensitive conditions, which will result to increased use of drugs like antihypertensives. But also there will be a need for new drugs due to the emerging climate sensitive diseases. And so, for example, your antibiotics due to climate sensitive infectious diseases. But these are also the other interesting areas. For example, we're not guaranteed of the stability of drugs because of exposure to high temperatures or light or humidity. And then, there might be changes in pharmacokinetics due to, the changes in body physiology. When you're exposed to extreme heat, then there might be some drugs that will, lead to a change in how we eliminate and metabolize these pharmaceuticals. And then finally, there might be also some potential interactions between exposure to intense heat and also drugs. So for example, there are medicines that lead to a reduction in sweating, which, affect our natural cooling mechanisms, your diphenhydramine, your benzotropin or tiotropium, and that will lead to a lesser ability to survive, for example, or to withstand extreme heat, for example, resulting from climate change. So this is an area of investigation. I encourage my fellow physicians to look into these potential issues in the future. And of course, another link to health is, when it comes to our food, our diet. And this is something that will require a lot of advocacy within the health sector, but outside of the health sector. Because right now, our food system is creating what is described as a global syndemic of obesity. At the moment, 1 billion people are over-consuming, and therefore they're overweight and obese. These are clinical problems. But also, on the other hand, there's another billion people on Earth which are under-consuming, and therefore they're undernourished, they're stunted, they're wasted. And then this food system is also the same food system that generates climate change through its own emissions, and also utilizes a lot of energy and water and destroys a lot of soil and other natural ecosystems. And as you can see here, the poultry and meat industry are actually the second biggest emitter of carbon after, the energy sector. And here we know that the consumption of red meat, in particular processed meat, has already been declared by the World Health Organization as a carcinogen. And then here you will see that the same food system, particularly, the poultry, meat, and livestock industry, they're the ones that are really driving this new crisis of antimicrobial resistance. The irrational use of antibiotics in human medicine is, it only comprises 25%, but 75% is due of the AMR is due to our pumping of antibiotics to chickens, pigs, and cattle as if they are, vitamins. And so we really need a renovation of the food system in order to reduce AMR as well. And that is why there is this new diet that has been proposed last year by a Lancet and Eat Foundation Commission. It's called the Planetary Health Diet. And I'll not go into detail, but as you can see, the bulk of the plate is composed of vegetables and greens, and a very small portion is only is for meat, is dedicated for red meat. And if you translate this into a week-long diet, that's actually only one meal within a week of red meat. And so I wonder if the Filipinos are ready for this global shift of diet from a plant-based, from a meat-based to a plant-based diet. And really, you know, reduction of meat is a quadruple win. It will reduce the rate of colorectal cancer. It will reduce CO2 emissions. It will lower the risk of antimicrobial resistance, but also it will prevent, you know, zoonosis, because as we know, you know, pandemics do occur when there is a tightening of the interaction between animals and humans. And that leads me to this last section of my presentation, which is about the links between climate change and COVID. I will be remiss not to discuss this aspect. And, you know, as I've said a while ago, climate change is really rendering our planet to become more conducive for a wide variety of health conditions, in particular infectious diseases. So, you know, there's strong links that as in a warming planet, you have an increased likelihood of old viruses or infections coming back and new ones emerging. And of course, it's complicated by our increasing consumption of wildlife. As you can see here, that's how this current epidemic started in Wuhan. And of course, due to globalization, a microscopic invisible virus can be transmitted and spread around the world in just a matter of months, if not weeks. And of course, COVID-19 is also a sneak preview that, you know, the healthcare system that we have now is not ready for a pandemic, and it's highly likely that it's not even ready for the effects of climate change, the ones that I've mentioned. And also, climate change, or rather the COVID-19 response that we have now, may be creating new forms of pollution, particularly plastic pollution and, you know, the increasing use of PPEs, especially if we do not address how we dispose them off, but also we don't come up with more innovative ways to, you know, reuse and reduce our unnecessary use of PPEs. And then, of course, we've been seeing a lot in the news that because of the lockdowns, you know, climate change, you know, the emissions have gone down. You know, the air has become fresher and more breathable. The skies have become bluer. Pollution in China has gone down tremendously. But this is the reality. As our countries and cities and economies begin to reopen, our emissions are now surging back. And that means that a pandemic like COVID-19 is not a good method for decarbonization, for environmental protection. And this is also the sad reality. As we continue addressing and responding to COVID-19, climate change is also continuing to develop and evolve, and its effects will be appearing in the next weeks, months, and years to come, from typhoons in the Philippines to locust crisis in Africa, heat waves in Europe, and by the time we reach January, the bushfires in Australia would have already come back. And we've already seen this here in the Philippines over the past few weeks. You know, our pandemic response is complicated by the natural calamities that have already started to happen. And it's really a dilemma between, you know, breaking your social distancing in order to flee away from your flooded house versus, you know, staying in the house but being a victim of the flooding, or, you know, with your, you know, roof being blown away by the wind. So these are really, you know, important dilemmas that we're now facing, and how COVID-19 and climate change are complicating each other. So to close my presentation, I know this is perhaps the most popular graph in social media. This clarion call to flatten the curve, and we know we're far from flattening the curve here in the Philippines. And as you can see there, we need to flatten the curve so as not to overwhelm the healthcare system's capacity, but also to give us time, to buy us time to enhance our healthcare system's capacity to add more beds, to recruit more health workforce, etc. But I think we need to embrace the same mantra. And we also need to flatten the curve of our carbon emissions and our ecological footprint. But unfortunately, unlike in the previous curve, unlike healthcare systems capacity, which you can increase, the Earth's capacity is unchangeable and in fact non-negotiable. And so it's us who will truly need to adjust. Because if not, and I know we've been discussing a lot about the first wave of COVID, the second wave of COVID, etc. I think there's a much bigger and much scarier, not just a wave, but tsunami of climate change and its health consequences that await us if we are not going to act now. So together, let's advance the health of both people and planet. Thank you very much for listening, and stay safe.